has been a miserably frustrating experience for way too many Americans.
Well, a lot of people would say that's an understatement. Problems still plaguing the Obamacare website, but healthcare and the internet are working together in the private sector. These doctors posting their prices on personal websites for health services. Patients say it works great. So is this proof the private sector does a heck of a lot better job than the government does? Hi, everybody. I'm David Asman. Welcome to Forbes on Fox. Let's go in focus with Mr. John Tamny, Rich Karlgaard, Elizabeth McDonald, Rick Unger, Mike Ozanian, and Sabrina Schaefer. So, John, government can't do the health care on the internet, but the private sector obviously can.
Yeah. Of course it can. Capitalism and the profit motive are about turning scarcity into abundance. They're about turning $1 million computer in the 70s into something that costs a couple of $100s today. Healthcare is expensive and scarce today precisely because the government has naively removed the profit motive from the equation. President Obama wants to make it universal, and in trying to make it universal, he's going to make it very hard for the average person to get.
So, Rick, this just proves the fact that the private sector could do the internet. That when the government gets into something, it gums up the works.
Well, there's two questions there. Yeah, obviously the internet thing has not gone as planned so far. I think it'll be fixed by the end of November, but we'll see. But to the real question here, which is can the private markets handle the pricing? Look, it's really nice. If you need to go get an examination or a physical, whatever, yeah, you can probably pay cash at a lower rate through that internet advertising by the doctor. But that's not where the real costs are in the healthcare system. The real costs are in expensive treatments like chemotherapy for cancer, heart disease, heart surgery. I got to tell you something. You can cut the price in half, and Americans could not pay for that if they didn't have insurance.
EMAC, look at these doctors that we're talking about. We're not just talking about general checkups. These are surgeons that are doing this on the internet. Surgeons. Knee surgery. I had a knee surgery myself, cost tens of thousands of dollars. They're now advertising on the internet. So it's not just the simple stuff.
Yeah, it isn't just the simple stuff. I hear about the cancer treatment, but the thing is, if the exchanges are always so great, why not let them stand against the existing plans in the marketplace? Why do you have to go so far as criminalizing existing plans? Now we're seeing, tens of millions of people losing potentially their employer-provided plans, and the small business plans and the individual plans. The market was showing you how to do health care before Obamacare. It was providing cheap coverage for many people across the country. And I got to tell you something, there's no such thing as a free lunch. Right now, those surgeons, David, that you're talking about, they're doing that because essentially the hospitals are saying, you know what, we don't want to deal with health reform. We don't want to get paid by health reform.
Mike was saying, while these private doctors are doing great work on the internet, think of this, what the healthcare exchanges are doing. They have to register 39,000 people a day in order to reach their deadline, their March 1st deadline of 7 million. 39,000 a day. If they can't handle a couple of hundred a day at most, how are they going to handle 39,000 a day?
David, my beef with this whole Obamacare versus the private sector has nothing to do with the computer glitches. It has to do with the fact when you look at procedures that are handled by the private sector because they're not covered by insurance, like LASIK eye surgery, like dental implants, the quality of those procedures has improved dramatically over the last 2 decades, and the cost has fallen dramatically because they're not encumbered by all the anti-free market regulations that are in insurance.
But Rich, one of the things that bothers me about all this, the mess in the government system with Obamacare, is that they may sour the public on anything on the internet, even the things that are working right in the private sector.
David, I think the public is smarter than that. There are two elements that you need for a real healthcare revolution. One is to bring in all the entrepreneurs to satisfy this growing demand for better and cheaper healthcare. And the second thing you need is price transparency. And as Oz points out, when you get that, you get LASIKs dropping, tenfold over 10 years. You can get your human gene, you can get your own gene sequenced for anywhere from $100 to $2,000 a day. We're on the cusp of an extraordinary revolution. Yeah. And if we only had price transparency and entrepreneurs coming in, I think that even expensive oncology treatments, to Rick Unger's point, would drop a lot.
Well, and Sabrina, it's just the opposite in the public sector. In the public sector, the more the government gets involved, the higher the prices become, right?
Right, and look, the government has been involved increasingly, both Republicans and Democrats, for over 4 decades in the healthcare system, which is why we haven't really been able to see some of these market proposals actually take place. But the fact is, if you move this to the private sector, we're going to see increased competition, increased choices, and a decrease in costs. And there's some very tangible things that can be done, right? We can move to a system where we encourage health savings accounts, where we encourage the deregulation of the insurance market, where we encourage health status insurance. These are real things. Oh, we have to get rid of that tax subsidy for employer-provided insurance. There's some real, very, very substantive changes that could have been made that would have moved things to the private sector in a productive way.
And John, just to an overall economic point, the point is in the private sector there's accountability. If you screw up, somebody can go elsewhere. But if the government eventually takes control of the entire healthcare market, 1/6 of our economy, we'll have nowhere else to go.
Well, yeah, if the government fails, they'll just get more money to fail even more. And, getting back to Rick's point about, he's talking about catastrophic needs for healthcare.
Exactly.
That's exactly what the market can fix very easily in terms of cancer and heart disease. We could buy catastrophic insurance very easily and very inexpensively precisely because it's far more rare. You've got to let the markets in. What Rick is doing, and it's very naive, is going to remove that market force from it, and it's going to make it very more expensive and very more difficult for people to get it when they most need it.
Rick?